little trouble. Here we go. There we go. Okay, so everybody, can you see my screen now? The muscles of mastication?
Yep.
Cool. All right, so there's how I find it. Okay, put it down there. So the muscles of mastication are the muscles that move our mandible so we can masticate or chew our food. Also, we use it in speaking as well, these muscles, because our mandible's moving. There's actually 4 pairs of muscles that are categorized as the muscles of mastication. And all of them are going to originate on the skull and insert on the mandible. So it's sounding pretty simple so far. 4 muscles of mastication, they all originate on the skull and they insert on the mandible. And they're responsible for our movements of our jaw, our mandible, to elevate it or close the jaw. When we close the jaw, we bring it up. All right. They also help us protrude the jaw. So if I turn my head, let me make sure I see you. See me, I mean, so I can tell if I'm in this way. So it helps us to move our jaw forward like this and back, okay? And then that's protrusion, and retrusion is the bringing back of the jaw. You bring it back toward the ear. So that's protrusion, and this is retrusion. And believe it or not, these movements occur to some degree every time we open our jaw and every time we close our jaw. There's also a component of that movement that is protrusion and retrusion. We're just not aware of it. It's not just going up and down like an elevator. And also, these muscles are functioning in our lateral movements of the jaw, left to right. Okay, just so I gotta massage my joint now because I have problems with that. So now these I have here, they're innervated. So the nerves that supply motor function to the muscles of mastication are branches of the mandibular division of the trigeminal nerve. Now, I'm not going to test you on that but again, this is one thing I think when you're reviewing for your final exam, if you see it here, it helps to start coordinate your understanding of things, but that's not part of your test this week, okay? All right, so the first muscle of mastication is the masseter muscle. It is a massively, incredibly strong muscle. It has 2 portions, or what we refer to as heads. All right, there's a superficial head that's more toward the outside of the face, and then there's one that's deep to that superficial head, or more toward the midline of the face. So your superficial head originates on the zygoma in the anterior 2/3 of the zygoma. So here is your origin of the superficial head. All right. It also originates a bit on the zygomatic process of the maxilla. What am I thinking? Okay. I'm not sure I understand that. Okay, I do understand it now. Okay, so part of the maxilla, it also reaches anteriorly to the zygomatic process of the maxilla. That component of the maxilla that touches the zygoma and helps to contribute to the zygomatic arch. I'm going to double check that. I'm not sure about that, guys. So let me double check this, okay? I'm not sure about how that works. Okay. Because here to me, it looks like this is the zygoma right here the zygomatic process of the maxilla is beyond the cheek here, right? It would be about, you know, about right here. And I don't see that coming that far forward. Okay. But so remember the zygomatic arch. I'm going to expect you to know the zygomatic arch. The masseter muscle originates on the zygomatic arch. That's all you need to know. I'm providing further details here. Oh, here's how it shows. It's showing you down here. A little piece of the zygomatic arch is right here. Okay. Okay, it comes more lateral, the maxilla, as it gets inferior. So that's where they're talking about it actually originating on the zygomatic process of the maxilla. Sorry about that. I'm not going to test you on that though. I'm going to say the zygomatic arch. Make it simple, okay? Now, do you all see though that that is the zygomatic process of the maxilla right here where I circled? Anybody not understand that? Okay, but it's this tiny little piece of that. Okay, the deep head is underneath of the superior head or deep to it. So if I draw in green the deep head, you can see it highlighted here because you can see it because I made the superficial head of the masseter muscle see-through or transparent. On this screen, you just see a little piece of the deep head up here on this picture, but you can imagine that it probably, you know, extends like this. Put a D on it.
Miss Simmons.
Yes.
I can't see what you're drawing.
No way.
Me neither.
Yeah.
Yep.
Oh my, like, I can't. I was gonna talk, but
The only thing I got was the O that you drew in blue. But that after that, I can't see anything that you've drawn.
Really? Okay, so let's see. Well, I'm going to do a different way then. Why don't I go into y'all's PowerPoint, okay? I've never had that happen before, and I have no idea why that is. I wonder if I go back to the blue, it would show up better. Let me try that first. Since you could see the blue, tell me if you see, I might be able to just work from, ooh, that's too big. Maybe if I work from, I can't draw on this. Let's see. Whew, these complications. I'm going to go back and try the blue again. Can you see that?
Yes.
Yes.
Cool. I'm just going to use blue.
all right.
All right. Now let me just try the other color again. How about, can you see green here?
Yes, I can see
Yes.
that.
Okay, well, let's just keep on going then. Let's see how that goes. You just please don't hesitate to let me know. Technology, that's it. Okay, so here you see the deep head, okay? And that originates along the posterior aspect of the zygomatic arch here, okay? More of the temporal process, but it does stretch along the entire medial aspect on the inside of that arch. But these are details I don't expect you to remember or memorize. Okay, I just put them here just in case on the boards. The masseter muscle originates from the zygomatic arch.
So this is posterior of the zygomatic arch or to the zygomatic arch?
What I'm going to say on the question is, and I'm going to ask you to, on your skull, label the origin of the masseter muscle, and you're going to put a line along the zygomatic arch like this. That's all you have to do, okay? These other details, the medial aspect, I add that here just in case, you know, it's on the boards, which I don't think it is, but here's your line. Can you see that black line there? Okay, there's your origin of this masseter muscle, just like that. Okay. Now, so that's the origin. Where does it insert? Oh, I got my green pen going there. I mean, my black pen going here. So it inserts down onto the mandible. The superior head inserts at the angle of the mandible, which you know where that is. Okay, let me get this going here. All right, so the superior head inserts at the angle of the mandible. I'm going to make it yellow here. So it's going to be like down here, the angle of the mandible. Okay, the deep head inserts a bit more superiorly on the ramus of the mandible. But basically they insert on this outer surface of your mandible here at the ramus and the angle. Okay, and this is the visible human. We have more pictures coming. And so what it does then, when this muscle contracts, it's going to bring the mandible up towards its origin, up to the origin, right? It's going to bring the mandible up. It's going to close the teeth. All right. Now, I just wanted to give you an idea of the magnitude of this muscle. And down here, you see highlighted in pink in a cross section of the visible human, the size of this pink muscle here in a, as if you're looking down on it, you cut the top of the head off. This white area is the ramus in cross section. Okay, it's been cut off here. And this pink is the bulk of that muscle. It is huge. And therefore very powerful. So when that 3-year-old bites your finger and it clenches down, it's gonna hurt. How do I know? I've had that happen. I remember the moment. Or the lady with Alzheimer's disease who doesn't know what the word open means anymore. Okay, so that's the masseter muscle. It's really very simple, okay? It originates on the masseter, inserts down at the angle and ramus of the mandible, and it pulls that jaw up.
Can you please repeat what you said about the pink portion of the cross section? What was that in the pink?
This is the cross section of the masseter here in pink.
Okay.
That's the bulk of that muscle. It's huge. Okay, the temporalis muscle originates in the temporal fossa, which you already indicated on your skull, nice and enormous like this, right? So that's the origin, right in that fossa. And it inserts onto the cornoid process of the mandible and the anterior border of the ramus. So here's that border right here in green. You can see that. And then here's the cornoid process. I'll draw it as if that zygoma was see-through. So this muscle is going to come down and insert here and down to here, okay? It's just going to grab that cornoid process. And this muscle then also pulls the mandible up along with the masseter. It elevates the mandible. Okay. And again, you see the size of this muscle that is helping that enormous masseter muscle enclosing the jaw. It's incredible. the power that is in our heads to, masticate food. But it also has a second function, and it functions in pulling the mandible back. So if I take my blue pen and I show you these fibers, oops, I'll draw on here, coming in this direction, right? So there are fibers back here on the side of our head, just behind our ear, basically. Whereas if you, let me make sure I see me in there, hitting my keyboard here, let me close that. So that if you retrude your mandible, find it, you can actually feel these horizontal fibers contracting. There it is, right there, kind of at the tip of my ear. Okay, right at the kind of like the just superior and posterior to my ear. And you feel them just going. Okay, so this functions, these fibers that are more vertical will elevate the mandible or close the jaw, and these other fibers help us retrude it. Again, here it is on the visible human. You see how it wraps around the cornoid process here. It does exist in that very large temporal fossa. And then this cross section I thought was so cool because you see the breadth of this, the width of this muscle here on the side of the head. It's the whole side of our head. And for patients who clench and grind their teeth, they can get a real headache in the side of their heads. That's why it's right there. So it's a massive, massive muscle as well. Okay, so on the outside of the jaw is the masseter and the temporalis. On the medial aspect of the jaw, we have the medial pterygoid muscle, which is the muscle here that is highlighted. Okay, so that's the medial pterygoid. I'm going to plug in my mouse here and see if I can't also work at making it a little bigger. Ooh. Doing it. Okay, let me go back. So the medial pterygoid is going to be on the other side of our ramus. Okay, so it has two heads here. One is this brightened head, the highlighted head here. This is the superior head or superficial head here, and there's a deeper head under it. And I'll outline that deeper head in green. Okay, so I see part of this deep head here. And then I see a little piece of it right here. Everybody got that? See the difference here? So there's two portions to this muscle we call the lateral pterygoid. So the deep head, all right, is going to originate on the medial surface of the lateral pterygoid plate within the pterygoid fossa. It originates on the medial side, toward the midline of the lateral pterygoid plate. And that's within the pterygoid fossa, right? So you can use your pterygoid fossa mark for one of the origins of this muscle. Okay. The superficial head I'm going to outline that in a different color, and I'm going to make that one purple. Let's try that one. Here is your superficial head. This part down here is probably also part of the deep head, but here's your superficial head. This one originates on the lateral aspect of the vertical plate of the palatine bone. So now you know why I had you label that. You've already got this labeled. It's the origin for a head of the lateral pterygoid. All right, it's that vertical plate of the palatine bone that comes up and goes into your orbit, ends in the orbit. And this has an insertion on the mandible that mirrors the masseter. It's just on the other side. It's on the inside or medial aspect of the mandible. So let's look at that. So it, like the masseter, elevates the mandible. Okay, it's like you have a sling. Your jaw is in between my hands, and when you close, these muscles contract to bring it up. So let's look at the next slide. It may be more helpful for you to understand these muscles. I'm going to go to the image on the right first because it's highlighted. Okay, in this image, your mandible is gone. But if I could draw it, well, it would look like this on this side. I don't think I need to draw it, but here I have the mandible in place. Here is the condyle, I'll outline that in purple. Here is the posterior edge of your ramus. Oops, didn't pick up my thing. Okay, there's the condyle, and this is the posterior edge of the ramus of your mandible, back here. So we're looking from behind the head. And so what you see here, I think very nicely is, here is your deep head. I'll put a D on it. Thank goodness the ink's working again. Okay, and it's originating up here within the pterygoid fossa. I'm going to color the lateral pterygoid plate green. That's your lateral pterygoid plate. Got it? And it's coming down and inserting on the angle of the mandible here, on the medial aspect. This is your lateral aspect. Out here. All right, what you also see over here, and I'll do it in, maybe make it, let's make it yellow. Here's your superficial head. It too comes down and inserts on the inner surface of the ramus of the mandible. But over here, you see it originating on the posterior of the maxilla. Once I get that mandible out of the way from in the first image, remove it, I can see from the back, yep, that's where that lateral, vertical plate of the palatine bone is located. Let's make a different color here. Okay, so here is my vertical plate of my palatine bone coming up to form. Here's the hard palate back here, the horizontal plate, but the vertical plate is here. Okay, I'm just outlining it a little bit. Ends in the orbit of the eye, and you have this muscle on the lateral, it's originating on the lateral aspect of the vertical plate of the palatine bone, and the maxillary tuberosity down here, that tuberosity of bone, and you know that from dental anatomy, or maxillary tuberosity too. So you can see if I draw the masseter on the left side, let me see if I can get a different color, I'll make it white. If I draw a white colored masseter muscle coming down like this and attaching, you see how these muscles form that sling of the mandible. They form a V. They're on each side of the mandible. They're working in the same, basically the same direction to elevate. So it's really going to hurt when that kid bites down on you. This is like the third muscle that elevates the mandible. So I just want to review that again, okay? So in the first image here, image number 1, you see the masseter muscle, you see the mandible, you see the muscles of facial expression. So here's your masseter here, beautiful masseter, temporalis up here. In the second picture, I have removed the masseter muscle and the temporalis so I can see the mandible. And in the third picture, I just took off the mandible. So now I can see the medial pterygoid actually kind of coming at me from this aspect, okay? Have to think about that one, huh? But it basically functions in one thing. It elevates the mandible. That's a gift here in a muscle like this. Okay, so that's the medial pterygoid. Here it is on the visible human. Okay, I have it in pink. We're looking at from the back of his head here and here. The sphenoid bone is in white. So you see it going to attach to that white sphenoid pterygoid fossa here and coming down and inserting on the angle of the mandible. That's pretty cool, isn't it? Again, here is a cross section, and this chunk of bone right here is actually the ramus. And here is the ramus again of the mandible. All right, so you see another muscle of enormous size on this medial aspect of the mandible that functions to close the mandible. Remember, over here is that big masseter muscle. I'll put an M on that just to remind you. So LP here. Lateral pterygoid, P is silent. All right. Look at that. That's a lot of muscle in that bone. Okay. This is just a little piece of probably the medial pterygoid plate here that shows up in white. That's not really, you know, I've cut through, I haven't gotten to that full process, the pterygoid process here. But you do see
So the pink is the lateral or the medial?
I am so sorry. You're exactly right. It is the medial pterygoid. Oh my God. Thank you for
I was getting confused.
I got that lateral pterygoid plate in my head. That is the medial pterygoid. Jeez. So when you got to know which muscles form the sling of the mandible. Think M&Ms. Medial pterygoid, masseter, M&M. Thank you. Good Lord. Okay. Now how's the lateral pterygoid muscle? Where there's a medial, there's going to be a lateral. And it too has two heads, a superior this time, here's the S, the superior one, and the inferior head down here. Oops. Okay, so the superior and inferior head of the lateral pterygoid. Also, it's called the external pterygoid muscle. The medial pterygoid is also called the internal pterygoid muscle. Two names for the same thing. So I have them in your headings like that. Okay, so the lateral head. The superior portion originates on the inferior surface of the greater wing of the sphenoid. Okay, so here is that origin right here. The inferior surface of the greater wing of the sphenoid, which is the bone I had you label in the lateral aspect of the skull. And this is really the ceiling or roof of the infratemporal fossa too. The inferior head, really easy one here, originates on the lateral aspect of the lateral pterygoid plate. Okay, I'll put that one in green here. So the inferior head originates on the lateral aspect of the lateral pterygoid plate here. So your medial pterygoid, if you have a pterygoid plate, if my phone is the lateral pterygoid plate, okay, the medial pterygoid originates on the medial surface toward the midline. The lateral originates there, and the lateral originates on the lateral aspect of the lateral pterygoid plate. Right? The two surfaces of the lateral pterygoid is where these pterygoid muscles originate. Both then heads will join or unite and insert at the pterygoid fovea of the mandible, which you already had to label. Okay, let me make this one, let's do this one in yellow. I think that shows up good. Okay, so in the pterygoid fovea of the mandible, and then another one in the superior head inserts into a soft tissue capsule that encloses the entire joint. Okay, the capsule of the temporomandibular joint. So that is going to be, if you can imagine, you know, a soft tissue capsule all around this joint, and the superior head originates in the capsule. It doesn't originate on the bone. So one of these heads is going to move the jaw, and the other head, the superior head, is going to bring the capsule of the joint with it at the same time as we move that jaw. So it's a really important differentiation to understand, okay? So it's going to move the jaw forward. It's going to actually protrude. I'm getting a little head. It's going to bring your lower jaw forward. When both of them contract, all of them, rights and lefts, contract at the same time, the jaw protrudes. Okay. And it's going to bring it's attached to the bone of the mandible, the neck of the condyle at the pterygoid fovea, and it's attached to the capsule that encloses my joint and brings the capsule as well as, or the anterior portion of that capsule forward, brings the anterior capsule forward. The posterior just stretches. Okay, so here is the lateral pterygoid muscle. Right here, the superior and inferior head. It's deep to the temporalis muscle. It's above or superior to the medial pterygoid, but it's located in the infratemporal fossa where your ball of paper is, or your spongy thing. Okay, so here, I gotta get my orientation. Okay, so on this image, I'm just gonna show you, we have the mandible here as see-through. So I'm gonna outline it, just the ramus and so on. We're looking through the ramus here. So you can see how the superior head is here, inserting on the capsule of the TMJ to pull the capsule, and then the meniscus actually that's within it forward, and then the inferior here inserts on that pterygoid fovea of the neck of the condyle, actually inserts on bone. And then you see it coming, you know, from the posterior, you see the lateral pterygoid up here. All right, let me erase that. Just give you an orientation because it took me a minute to figure it out, even just and having put it here. The lateral pterygoid plate is here in green. And I'm going to do your sphenoid bone here in blue, the greater wing, so to speak here, okay? So the superior head, I'm gonna put it in blue, originates on the inferior surface of that sphenoid bone, and your inferior head originates on the lateral surface of your lateral pterygoid plate. Okay? Anybody have any questions? Okay. So here is the lateral pterygoid muscle here, and the ramus of the mandible is white. I've cut down through in a different location here in the cross section. So we see more of the sphenoid bone and the lateral pterygoid plate. This would be this is lateral pterygoid. I put an L on it. I'm up higher in the head. I don't see teeth. I don't see anything. I just see the nasal septum and some things here. And then this would be your medial pterygoid. Here, you see a piece of that coming from the medial aspect of that lateral pterygoid plate here. That's shown in white. Isn't it interesting how, even though they probably had him pretty much, you know, set in a certain way on the table when they were doing this, how different the levels of the condyle and the ramus are. So here you see a whole ramus in cross section. Here we're all the way up in the condyle. And as I've used the visible human with things, you know, I see, you know, back here, I see only the ear lobe and I see the mastoid air cells probably here. Here I see more of the ear. It's interesting how asymmetrical our body really is. It was interesting because having looked at these images a lot over the years, I was at work one day and the hygienist's husband was in her chair, the other hygienist, and they had had a CAT scan done of his head. I can't remember exactly why, but they were scanning down through the head in cross section, and the hygienist got really upset because suddenly there was a black area on one side of the jaw, but it wasn't over on this other side where there were teeth, there were teeth roots and such. And she called the doctor over, what is this? And I happened to be there and I looked, I said, oh, our body's not symmetrical. You're seeing the sinus still over here. You're not seeing, the sinus is black on a CAT scan. This is filled with green jelly in the visible human to make it apparent. So I said, don't worry, I don't think it's anything. I think it's just that we're not bilaterally symmetrical in shape and form. So it's funny how looking at this really helped me understand what she was seeing. So she just scrolled down and then everything was fine. She could see more of the teeth and such. So that's just the nature of the human body. Okay, now, what does this muscle do? We already talked about when both the right and left pterygoids on each side of our head, when they both contract at the same time, they are going to pull that insertion here, our insertion, they are going to pull it towards the origin. So that mandible is going to protrude anteriorly. These teeth, lower teeth, are going to jut out in a crossbite, probably. Our origin is anterior to the insertion. It's going to pull that insertion toward the origin when it shortens. Now, when one side, when say my right one contracts, I'm going to go back to another image. Okay, let's say only this muscle contracts, not my left one. It's going to pull that condyle this way towards its origin over here, right? And that's going to shift your jaw laterally. So when my right pterygoid contracts, it shifts my jaw to the left because it's pulling my mandible closer in toward the skull, in toward this sphenoid bone. The other condyle stays in place, just kind of rotates a little bit. So you can really see in this picture how that's going to happen, right? Sure helps seeing it, I think, versus just reading about it and memorizing it. So naturally, when I shift my jaw to the right, my ramus over here is going to be closer to my internal skull here than this side. This side is going out.
Can you go over when they both contract again?
Yep. So I can do it on this same slide. So when rights and left contract, there's not going to be just one, okay? They're all contracting. So when rights and left contract, they bring it protrusively, your mandible. It's going to bring the mandible toward both origins on right and left, and it works then to protrude the mandible. And what I suggest you do is play with your mandibles on your skull. I'll show you that in lab, how that works, okay? But we'll play with that mandible, play with that on your budget skull too. So I'll go over that in lab. Let me make myself a note. Ooh. All right. Oops, rats. My goodness, button must be stuck. I'm on too low on the pad. Okay. So when one side contracts, the jaw moves laterally to the opposite side. So here's a really cool image that a student took, an x-ray. That's a pretty cool x-ray. All right. So here it says coronoid process. This is the tip of the coronoid process you see right here. Okay, it would go on up then to the condyle back here. All right. Now, this is a third molar. This is tooth number 1. I'll put a 1 there. Okay. This looks like muscle fibers here of the lateral pterygoid muscle. To me, it's soft tissue, definitely. And these digital x-rays are just amazing at how much soft tissue they use. They use much less intense radiation. When we used old film x-rays, we needed more intense radiation for it to produce an image on the film. So it just blew through the tissue. You couldn't even see this sort of thing. But now with digital. So I think that's the superior head. Up here, and here is the inferior head down here. Pretty cool, huh? That student had that x-ray back there, let me tell you. She had a very compliant patient. Okay, so those are the 4 muscles of mastication. There are muscles that you will have on the board exams that you need to know, okay? Now, muscles that attach, the hyoid muscles, okay? These are much thinner slips of muscles, and the hyoid muscles are muscles that attach to the hyoid bone. Your hyoid bone is in your neck, just below your jaw, And it's this bone right here. It's that horseshoe-shaped bone within the neck. It's a floating bone, meaning it doesn't connect. I mean, it's not part of another bone. So it's literally nowhere connected to another bone itself. So the suprahyoid muscles are groups of muscles that are superior or supra to the hyoid. Okay, so if I erase the hyoid bone, because I made it red foolishly. Oops, it's red here again, eraser. Okay, the suprahyoid bones are going to connect to the hyoid bone, but they're going to be located then superiorly to it. So the suprahyoids are these muscles here and here. The muscles that are infrahyoid groups are muscles that are inferior to the hyoid bone. So these are the muscles that are located below it. All right, so we're only going to learn some of the suprahyoids today. And again, we have a video here. Let me see. I know y'all could probably use a break. Let me see if I can get rid of this. It's not going to let me do it that way. Okay. I'll let you copy and paste that video because it really does help you understand these muscles. So the suprahyoid muscles are going to help us in swallowing because it elevates the hyoid bone, but it also, they will assist in chewing and depressing the mandible as well. So they're going to help us open the mandible to masticate, to take in our food. And then also as we do the chewing process, they will continually work to bring the mandible down so that it can then, food can be repositioned on the teeth and then brought back up by our muscles of mastication. All right, so here are the inferior muscles. And again, now those muscles, the infrahyoid muscles, are going to stabilize, or they're going to contract and stabilize that hyoid bone when the suprahyoids function. Something has to keep that hyoid in place to enable those suprahyoids to pull the mandible down rather than just, pull the hyoid up in a swallow. Does that make sense? It's like these guys down here are hanging on to it so it stays still. So the muscles above it can work to bring the mandible down.
Can you go back?
Hmm?
Did you go back? I couldn't write that fast.
Go back to where?
To the suprahyoid.
Okay. They're not on your thing, this stuff? On your PowerPoints, your thing? We're tired. So in any case, so yeah, the suprahyoids assist in swallowing. They elevate the hyoid and the larynx, and then they assist in chewing by bringing the mandible down as we chew.
Okay.
Okay. Do you not have these things on your PowerPoint?
I don't have the PowerPoint with me. I'm just taking notes.
Oh, okay. Oh, you're working hard, really hard. Okay, so let's talk about the suprahyoid muscles. One is the mylohyoid, okay? That's a word you've heard before, right? So its origin is on the medial surface of the body of the mandible, and that origin is what? What?
Mylohyoid ridge.
There you go, the mylohyoid ridge. They originate on the mylohyoid ridge. This is the muscle I've been telling you about, forms the floor of the mouth. It extends from both medial aspects of the body of the ramus. So here it is highlighted. So right and left sides meet at the midline of the floor of the mouth, and posterior fibers insert on the hyoid bone. So you see the insertion down here. Let me do it in green to make it color coded. Here is your insertion, the hyoid bone. Okay. Otherwise, they meet at at the midline of the floor of the mouth here. Okay, and that's one insertion, and then here is your bony insertion. But we don't have a hyoid bone on our skull, so we're not going to label these, except for the origin. You're going to label the origin as the mylohyoid ridge. And this is just another different view of your mylohyoid muscle on the right. And I'll just outline it in a dark color here. There's your mylohyoid muscle there. So you can see it's coming down from the mylohyoid ridge on the medial aspect of the mandible here. That diagonal ridge in the posterior region of your mandible, right here. That's its origin. Okay. Here is the muscle here without the mandible present. You see it extending right to left here. Guess white wasn't the best color with that, was it? Let's do a light green. I'll make it light green here. Okay, and you see how it forms the floor of your mouth. What do you think this muscle is here? This one here, I'm going to put an X. It's coming from the anterior mandible. It's reaching up towards something. Its origin is the anterior, medial aspect of the anterior mandible. So that would be your genial tubercle. It's extending up and back to the tongue.
Is that the digastric?
Now that's going to be the genioglossus. The genioglossus. I'll never ask you this like this on the test, but you know, it's just to refresh your memory. Your genioglossus. And then here is your styloglossus. I'll put SG, I can't write here. I can't even do that. That's the styloglossus because up here is your styloid process. Just to refresh your memory, just to bring things back. So I went, you know, my friend, the visible human here, I'm going to just show you, show you the mylohyoid here on the left in pink. Again, you can see it is, that forms the floor of the mouth here. I just think it just helps reinforce things. So what does the mylohyoid muscle do then? For one thing, it forms the floor of your mouth, right? We already talked about that. If the hyoid is stabilized, okay, I put a green X by hyoids. If the hyoid is stabilized, when that muscle contracts, then it's going to depress the mandible. Bring it down a bit too. So it also is like, you know, We already talked about the suprahyoids in general, depress the mandible. It will elevate the tongue if the hyoid is not stabilized, and it will elevate the hyoid bone too. So if we contract that muscle, we shorten the fibers, it can move up the hyoid bone. So it'll, help us function in, in swallowing. But you can't elevate a hyoid bone that is stabilized by the infrahyoids, right? Those infrahyoids are tugging down, they're holding it down. So when it contracts, the mouth opens. Okay, geniohyoid muscle is shown here highlighted. That's one side, and then the other is next to it. There's a right and a left to all of these things, okay? It's just lies superior to the mylohyoid muscle, again, originating at the genial tubercles. And it goes posteriorly to insert into the hyoid bone. So our genial tubercles would be here. I'll put a G. Oh, let me make it red. Double click. Big red G on the genial tubercle. The hyoid bone is posterior and underneath the mandible. And that's its origin back here. So you can see how, if we stabilize that hyoid, it can pull that mandible down. Okay. Here's another picture that shows you better the hyoid bone here. Okay. Here is the geniohyoid, here highlighted. And really quite parallel to it is the anterior belly of your digastric muscle here. And then this is the hyoglossus muscle going up to the tongue. This is all from that essential skeleton, or I can't remember what that skeleton app I have. Okay, digastric muscle. You remember the digastric probably from A and P. It has two bellies, an anterior and posterior belly, two portions, okay? So your digastric muscle is shown here. I'm going to highlight it. And let's see, let's do purple because it's a very different color. So here's your digastric muscle coming down from your styloid process to the hyoid bone here, right? And then it runs just inferior to geniohyoid in pretty much the same direction. That's the anterior belly, posterior belly and anterior bellies. Okay. So let's look at the the anterior belly. It originates here at a tendon of the hyoid, on a tendon of a hyoid bone, but you can just remember hyoid bone, whether it's a tendon or not, I don't think is anything that's, that detail is not necessary. So that's the origin. It's going to insert in the digastric fossa of the mandible, here and here, inferior to the genial tubercle, which you've already labeled. So you can use that as your insertion point for your digastric muscle, your anterior belly. So again, when it contracts, it's going to pull that jaw down, down and back toward the hyoid bone. Okay, if my hyoid is back here, it brings it down. Okay, so it's going to be depressing the mandible. When you're down, you're depressed. The posterior belly is back here again, okay? It is originating here on the mastoid notch. So you had to label that already. So you know where that is, so you don't have to, study that again. Well, you do, but who keeps that in the tip of their tongue? It is going to come down here and insert also on the hyoid bone at the intermediate tendon right here. But just remember hyoid bone. It inserts on the hyoid. And when it contracts, it's going to either elevate the hyoid upward and back toward the origin, or if the hyoid is, if it functions to stabilize the hyoid, it can do that and help in the depression of the mandible with the, which is the function of the anterior belly. So it can either elevate the hyoid or stabilize it so then that anterior belly actually depresses the mandible. So there's a lot of muscles that function in stabilizing the hyoid. It's not just one, just like there's a lot of muscles that move the mandible. Okay. Now, stylohyoid lies parallel to the posterior belly of the digastric muscle. So you're going to see this on the life forms. And what you want to do is follow the way these fibers go. If the fibers of the muscle go up toward the styloid process, it's the stylohyoid. If it goes more posterior toward the mastoid process, it's the posterior belly of the digastric. But they run rather parallel to one another, don't they? So this origin is the styloid process here. For the, oops, that's blue. Well, it doesn't matter. There's no blue on here. Okay, I'll make it blue. The styloid process. And then it inserts on the hyoid bone also, but not at the intermediate tendon, but it does insert on the hyoid bone. And that's all you need to know. Inserts on the hyoid. Ooh. And it basically does the same thing as the muscle that's parallel to it. Posterior belly gastric. Okay, either elevates the hyoid bone and pulls it up and back, or it's going to stabilize it so the mandible is depressed when these anterior muscles function. And that, my friends, is the suprahyoids. Whew. So we'll look at these on the visible human. We'll have you, make sure you get your origins and insertions labeled correctly and in lab, all right? And if we have time, we'll look at some of the videos. So why don't you take a 10-minute break? I kept you long just to get this done. I'm sorry, but let's take a 10-minute break.